Synthesis of Professional Nursing, Capstone and 5-Year Plan Presentation by Donna Vega. For Lamar University, instructors Dr. Palmer and Ms. O'Brien. Hello, my name is Donna Vega. I'm an RN, and I've been a nurse in good standing for the last 34 years. I began my career as a nurse aide while I was in my LVN program from 1983 to 1985. Once I achieved my LVN in 1985, I worked in various areas of nursing. I was at a nursing home, doctor's hospital, Baptist hospital, St. Mary's Hospital. I did private duty, and I also did home health. While I was working in home health, I achieved my associate degree and began working at St. Elizabeth Hospital in 1994. I am BLS and ACLS certified and am currently in the baccalaureate program at Lamar University, Beaumont campus. I will graduate this May 2019. I have worked probably every area in nursing: med-surg, the emergency room, ICU, the burn unit. I've worked with diabetics, renal patients, heart patients. I am currently a progressive care unit nurse on telemetry. I am also a member of parish nursing. I precept new employees. I was a Daisy Award recipient in 2011, and I am bilingual. I speak German. I had dual citizenship until I was 18. I was nominated for Employee of the Year in 2008, and my philosophies include: do the right thing the right way the first time, and an ounce of prevention is worth a pound of cure. On a more personal note, I am very fond of flowers and butterflies and birds and pretty much anything nature. I love the outdoors. The first learning outcome is for humanity and society construct. Practice safe and effective holistic patient-centered care to a variety of patients in multiple settings from a global perspective by incorporating theories and evidence-based findings. These outcomes were achieved by 100%. In the class Theories in Nursing, we were presented a nursing overview and growth of the nursing profession, the different theories, and the worldwide presence of nursing. My favorite theorists include Nightingale, Watson, and Newman. In Care of Communities, we were presented with society and communities as a whole. The windshield survey gave us an opportunity to get out in the neighborhoods and actually see what was going on in each particular section. What kind of churches were there? What schools were there? What kind of road structure did they have? What were the special needs populations? Did they have disaster preparedness, and how to teach disaster preparedness? For learning outcomes number 2 and 3, this is the lifespan health continuum construct. We learn to support patients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. Evaluate patient-centered care across the lifespan based on common and complex, compromised multiple health states and needs when considering multiple determinants of health. This outcome was also achieved 100%. The comprehensive holistic health assessment was performed with Shadow Health Online, gave us the opportunity to improve our assessment skills and expand our assessment knowledge. In the class Comprehensive Multiple Health States, we were required to read a memoir of someone with a particular disease process. This was a very good way to become immersed in someone's life and see what they go through on a day-by-day basis living with a disease process. Reflections 1 through 4 gave us the opportunity to reflect on different case scenarios, different disease processes, And the nursing process or care plan helped us evaluate the processes that we employed. The community-based service learning PowerPoint was very informative and very interactive. Evidence-based practice and clinical reasoning construct. This is learning outcome number 4. We learn to synthesize clinical information and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. This outcome was achieved by 100% in the class Evidence-Based Practice Inquiry and Clinical Reasoning. We were asked to critique a research paper. This helped us to learn how to question the different information that we were presented with and to make determinations as to whether the information was accurate. This required that we do active research, and it employed the use of critical thinking skills regarding these difficult case scenarios. It taught us to some degree that knowledge is power, as Thomas Jefferson said, and it helps to know that knowledge is power. Patient-client-centered care. Every course throughout this entire program focuses on patient-centered care, safety measures and issues, and have a collaborating, educating partnership with the patient and their families. The collaboration was fostered and enhanced by all of the scholarly discussion boards, which promoted the opportunity to exchange ideas and thoughts with my colleagues. The professional roles construct is learning outcomes number 6 and number 7. This differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients as a member of the interprofessional and intraprofessional healthcare team. We learn to demonstrate professional integrity, effective communication, active inquiry, and service to the community. These outcomes were achieved 100% in the class Leadership Management and the Healthcare System. Implementation, elimination, and self-examination of leadership qualities, Global Health Professional Nursing Organization PowerPoint, and a paper on leadership, making us look within ourselves to see what qualities we possessed as leaders. Texas Board of Nursing Practice Act. The mission is to protect and promote the welfare of Texans by ensuring that each nurse is competent to practice nursing safely, and provides us with the rules and regulations to do so. The 5-year plan, which is my nursing journey. Once I graduate from the baccalaureate program, I want to obtain or accomplish the Progressive Care Nursing Certification. I'd like to develop a learning packet for Progressive Care Unit and expand the preceptorship role. And I'd like to accomplish my master's degree and obtain a teaching position. By the end of this 5 years, I'd like to start working on becoming a nursing PhD. Remember, there's still room to grow. And as Mother Teresa said, not all of us can do great things, but we can do small things with great love.